Partisan politics at its finest today in the U.S. Senate as two competing health care bills failed to get the 60 votes needed to pass. So unless something changes in the very near future, the Affordable Care Act subsidies will evaporate at the end of the month, and the cost of health insurance is expected to at least double for 22 million Americans enrolled in the ACA. The Democratic proposal to extend them for 3 years only got 51 votes, with only 4 Republicans voting for it. But before that, there was a vote on a Republican plan, which only got 53 votes, with no Democrats voting for it. That bill was co-authored by Idaho Senator Mike Crapo, and that would be a replacement for the Obamacare subsidies. So let's bring in Joe Paris now, because Joe, you followed this over the last year. So what did these votes on the Senate floor look like today?
Well, to put it simply, they're a standstill, and more progress needs to be made, Brian. A bill, again, written by Senator Crapo and Senator Bill Cassidy of Louisiana, looked to invest into health care savings accounts for adults earning under 700% of the federal poverty level, so about $110,000 for a single person, about $225,000 for a family of 4. Those groups would get about $1,000 a year for a health savings account, and that's for medical costs. And if they're under the age of 50, older than 50, you'd get $1,500 per year until you're 64 years old. And then when you're 65, you can get onto Medicare.
Our bill provides pre-funded, patient-driven health savings accounts for Americans enrolled in qualified Obamacare bronze and catastrophic plans. Importantly, low-income Americans will still receive subsidies for those Obamacare plans through the permanent portion of the premium tax credit system.
That's Senator Crapo this afternoon arguing on the Senate floor that extending the ACA as is costly and doesn't solve fundamental issues with the American healthcare system.
A 3-year extension of this program with no reforms, costing hardworking families $83 billion, with tens of billions of dollars going to insurance companies and fraudsters, is anything but clean.
Crapo's points were almost immediately debated in closing by Senate Majority Leader Chuck Schumer, Democrat from New York, and he was clear about opposition to the Crapo-penned plan, calling it junk insurance.
The big idea is essentially to hand people about $80 a month and wish them good luck, say you're on your own no matter what happens. And to even qualify for that check, Americans would be forced onto bare-bone bronze plans with sky-high deductibles, $7,000 or $10,000 for an individual and tens of thousands for a couple. So the deductibles are so high that even that is not paid for by the $80 a month. And then Americans are stuck and have nothing, nothing, nothing.
A fact check on that claim has found that data from the independent health policy group KFF shows the deductible for a bronze or catastrophic plan is just under $7,500 for 2026. That's one person. It's in the range of about $15,000 or more for a family of 4. Critics of the Republican-sponsored plan say in the event of a significant or even mild health care event, families still wouldn't be able to afford a deductible, and the problem of medical debt continues for millions of Americans. However, Senator Crapo argued that his proposal would lower insurance premiums by funding cost-sharing reduction payments, and that would bring numbers down for people on the silver plans, Brian. In the end, though, it's all moot. Neither the Republican-backed proposal nor the extension of the ACA passed the floor, continuing the stalemate. So it's a big question for Americans and Idahoans. Today, I spoke with Your Health Idaho for our upcoming Viewpoint special on this. People that are waiting for something to change in D.C., maybe they're hoping Congress makes a change. Well, here's the best advice from the experts.
We are getting a lot of feedback from Idahoans. Everything from, well, I'm going to wait. I don't want to make a decision today. For those of you that are waiting, please don't. You will have an opportunity to change plans if things change, but don't wait.
The concern there from healthcare advocates, Brian, that Americans waiting for a better price, even if they see scary numbers, is if they are without insurance altogether, that could be catastrophic not only for their family, but for community funds as well.
We mentioned 22 million Americans. About 100,000 Idahoans are covered by these subsidies. Is that correct?
Yep, a little more than
A
100,000.
little more than 100,000. So it has a lot of this weighing on those people.
Yeah,
So,
and it's a stressful time, as we've heard from Idahoans, that they see scary numbers and they don't know what to do. Again, the advice from the experts is enroll in something, and if something changes, they would have a special re-enrollment period. We have a full conversation coming up Sunday morning at 9 a.m. right here on 7.
if something changes, chances of that happening before the end of the year?
They look slim right
Slim,
now,
yep.
but when Congress gets motivated to do something, it can happen in a matter of hours.
Could be a Christmas miracle. We'll
Oh,
see.
they could be.
All right, thanks, Joe.